Hi, my name is Anai and I'll be teaching you the proper way to assist the patient with a bed bath or a shower. So before beginning, you want to always make sure you perform your proper hand hygiene. In another video, I did a video on how to do the proper hand hygiene and to make sure that you do it proper. So you want to go ahead and get some gloves. It's super important to put on your gloves when taking care of a patient. If they have probably an allergic reaction to latex, you could use some latex-free gloves that your agency could provide you with. So in this case, I don't have the proper equipment or a real patient. I'll be trying my best of my ability to explain it more verbally than like physically, because I don't have the proper equipment. I'll be trying my best. Like I said, I'll be using this chair as an example of like a tub, I guess. And then this is my patient right here. So I'll explain what is it that you should do as an assistant and how to best assist the patient. So before getting started, I'm going to tell you a few things you have to do when you walk in the room. So you want to make sure when you walk in the room, you provide complete privacy. Super important. Privacy is very important, especially when you are coming to do like a bed bath or a shower, assisting them or anything like that. It's super important to provide privacy. Number two, you want to come in the room with positive energy. You want to greet the patient or the resident. You want to introduce yourself. You want to let them know how you'll be assisting them and what you'll be doing to them today. You want to make your patient feel comfortable. Another important step is always identify your patient before doing anything. You want to make sure you use two identifiers, meaning you want to ask for their name or their birthday. Both. You want to ask for both, their birthday and the name. And you want to check their bracelet as well. So I'll kind of do like a quick example of how you should come in the room and speak to your patient the proper way. So you want to come in the room, close the door for privacy. You want to introduce yourself. Hi, my name is Anai. I'll be assisting you today with a a shower, or to take you to the tub. And then you want to make sure to identify the patient, so you'll ask them for the name and the birthday. So can I give your name and your birthday? Okay, perfect. So once you get your information, you want to also go ahead and check your care plan, and you want to see if the patient has any, you want to make sure if your patient has any wrist falls, if your patient could assist themselves, would they need a certain assisting device. You want to make sure if your patient has any skin problems as well. You want to just make sure to check your care plan. You want to make sure, also very important, is there any specific products that your patient should not use. For example, probably they have a skin problem where they need to use like a certain type of body wash or soap or anything like that. You want to make sure you know how many co-workers you will need to do the transportation from the bed to the tub. So in this case, I checked my care plan. My patient, he could kind of assist himself. I'll be supporting him with help as well. And my patient does not have any allergies, any skin problems that are severe to any soap or body wash. So those are very important information to gather before attending the patients, just so you could be on the safe side. So let's get started. So I have my patient here, and it's important to always explain what you're doing so your patient could feel comfortable and knows like what you'll be doing to them. So my patient here, in another video, I explained how to properly use a gait belt. So in this case, I'll be transporting my patient with a gait belt to the tub because my patient has a weak side. So you want to help remove the blanket. You want to And this is a chance where you want to help your patient get into a robe. So you get the person into a robe. You want to help them up in a position, in a follower's position of the bed, and lower the rail. So then this is when you'll help the patient kind of dangle from the bed. You want to support the back as well and help them, the patient. In this case, I have this as an example. So it's kind of hard to explain, but like I said, I'll try to the best of my ability. So let's say your patient is now sitting down on the bed with the robes on. You want to make sure to provide them with some non-slip stocking socks or something so your patient could be safe. You put on the robe on the patient. Now you want to grab your belt. In another video, like I said, I made a video on how to properly use a belt. In this case, I do not have a belt with me, but I will try to explain how you do it. Just a brief explanation. So you want to grab the belt. You put it over the patient. Teeth side of the belt should be facing outwards, never towards the patient. You want to pull the other side of the belt in through your belt. You want to tighten it. You want to make sure it's pretty snug, not to the point where it's uncomfortable, but pretty snug. And you could check that by putting maybe a finger or two to make sure a patient can at least be comfortable, but it's pretty snug. So you would take a very good grip on the back of the belt, and you want to like that help the patient up. So now your patient would be upright. So you'll walk from the room to the tub. In this case, like I said, I'll be using this as my tub. So then I will help my patient walk, but slightly behind the person, just to make sure I'm gripping them right on that belt. So you want to take a step right after your patient. So you'll want to guide your patient a little bit sometimes, like tell them left foot, right foot, and get them to the tub. Once you're in the tub, you want to help them slowly sit down. Now pretend this is the tub. So I have my patient here. You want to help them remove everything, but you also want to promote, you want to make them feel as if they're independent. So I'll just be helping them take off the belt. And if your patient really needs help removing their clothes, you will assist them with that. Some patients are able to remove their clothes, and you should go ahead and allow them to do so for respect and privacy, and also to promote to make them feel more independent about themselves. You don't want to do every single thing for the patient. It makes them feel as if they're vulnerable. So if your patient cannot remove their clothing, you go ahead and remove it for them. So in this case, my patient's fine. He could remove his clothes. So you want to make sure to grab a non-slip rug that your agency might provide you with, and you'll put it on the tub. It's super important so your patient won't slip. You want to gather all the supplies your patient will need for a shower or a bath near them. So you would grab a small table, put it right next to them with their body wash, soap, or anything like that, lotion, anything they might want. Put them right next to them at their reach, where it's not difficult to reach at all. Now you want to turn on the water, check the temperature. You want to help the patient reach over and check the temperature. Super important. You want to make sure that the patient is comfortable with the temperature. You want to ask them, is that temperature fine with you, sir? Do you need cooler? Or you want to also teach them how to turn the water to hot or cold. You want to explain to them how you use the shower every time. You want to tell them where the call light is at. So right next to them, making sure it's at the reach as well. So now this is the time where you go ahead and walk out the room, but you do not want to be far away from the room. You want to try to stay nearby. And you close the door for privacy. Usually the door should say that is in use or not in use. So then you put as in it is being used right now. You want to step away, close the door to provide privacy for the patient. You want to make sure to come in and check every 5 minutes. Before walking in the room, you want to go ahead and knock on the door. Super important to knock on the door for the patient's privacy. The patient should not be in the shower no longer than 20 minutes. So every 5 minutes, you want to come in and check on your patient, make sure they're fine. Do they need anything? Do they need you to reach them something? You just want to make sure your patient is comfortable, he's fine, and no accident. You want to prevent accidents, the most important part, because most accidents happen in showers because it's slippery, things like that. So once your patient is done showering, you'll knock on the door, you'll walk in. Then this is when you'll ask your patient, do they need help drying themselves? So you'll turn off the water. You want to drain the water, super important. You don't want your patient to step on the where it's slippery and wet, so you drain all the water. This is when you'll grab a towel and you'll tell your patient that if they need help assisting, if they could dry themselves, it's fine. But if you need to help them out, go ahead and do so. So I'll let my patient know that I'll be putting the towel right behind them. You never want to, when drying a patient, you never want to like rub the towel on them. You want to mostly do a pat dry to prevent like drying their skin out. So you want to pat dry the patient. Make sure to help them pat dry the entire body. If they could do it alone, go ahead and let them to. You want to let the patient do as much as they can for themselves possible. So now that I dried the patient, you'll dispose it in the linen bag that your agency has. Now this is where you reach over and give your patient a clean gown and a clean robe, clean stockings, everything. So you'll grab a clean a gown and a robe, and if your patient could put it on alone, then it's fine. Again, if they need help assisting them, this is where you help them put on the gown and the robe. So then your patient should be ready. So then you want to make sure you dry their feet very well, and then you want to provide with the non-skid socks and some non-skid shoes or some. So you want to make sure your patient's super protected from slipping from in the tubs. This is a very slippery part. Make sure to grab your gait belt, like I said, put them around the patient. Make sure it's pretty snug. You want to put it over, teeth always outwards, never inwards. You grab the belt from behind, help your patient up, and then this is when you walk slightly behind the patient, slowly back into the room. Let the patient know you'll be sitting them back down. If they want to lay down or maybe sit down for a while, it's up to them. Make them their choice. Let the person make choices of their own as well. My patient wants to lay down, I help them lay back down to a comfortable position. I'll put the rails up, cover them up with a blanket, and then when you're done, you're going to go ahead and toss out the gloves. Perform proper hand hygiene. Once you've done the proper hand hygiene, you want to go ahead and report any observations you did on the patient. So you want to make sure to see if you notice any dryness on the skin, any redness, how did the patient tolerate the shower or the bath, how much they were able to assist themselves. Also, you want to make sure to ask your patient before leaving the room, are they comfortable, do they need anything before you leave. Always remind them where the call light is at. If they need anything from you, they could just simply press the button. Also, super important to if you see any observations, like I said, if you see anything wrong with their skin, probably irritation, you want to go ahead and tell your nurse the observations that you made. Also, make sure that your patient is super comfortable. You want to make sure that if they need anything at their reach. You know, maybe rearrange the room a little bit to their comfort, and go ahead and do so. You want to make sure your patient is comfortable, relaxed, especially after taking a bath. And yeah, that is it. Thank you.